Thank you for the introduction, and thank you certainly for the time. Certainly, as Fern had mentioned, we actually decided to launch this initiative in March 2009, so really it's just been over a year that we've been engaging in this work in terms of chronic disease self-management programming. We've had the support of the Grey and Bruce Integrated Health Coalition, a local planning table up here in Grey and Bruce, and it was in response to exactly as Fern had indicated. We're seeing the same trends in healthcare, whether in Grey and Bruce or certainly more provincially, in terms of those with chronic conditions utilizing a high number of resources, whether in primary care, emergency departments, hospitals, and so forth and so on. And we know the trend is, as folks are aging, the number of chronic conditions tend to increase. So what I thought I would do is certainly just speak to the work that we've been engaged in the last year. And the work that we started a year ago actually dovetails nicely with the work of the South West Self-Management Program that the LHIN has so kindly supported. So I'll tie that in as well at the very end. In terms of pulling this program together, this initiative, it really was more of a grassroots sort of thing. We presented a proposal to the coalition and explained the merits of offering some sort of chronic self-management program locally. And we'll describe sort of some of the elements, the benefits of the program in a moment. But what we had is certainly an indication of support, but also these are the organizations, members of the coalition, that actually financially supported our work moving forward. In the handouts that you have, there are actually 3 slides that I've hidden from this presentation, but there are a great deal of details as to how the support was broken down. And I know I only have 10 minutes, so I'm not going to go into that level of detail now, but if you'd like to reference it, you're more than welcome to. So how did we get to where we are? Certainly, internationally, Stanford, the Stanford Chronic Disease Self-Management Program, otherwise known as the Living a Healthy Life with Chronic Conditions Workshop Series, it's an evidence-based intervention that's licensed by Stanford University. So Kate Lorig and her colleagues over the last couple of decades have put together a program which shows remarkable benefits when utilized with those with chronic conditions. The benefit involves an improvement in clinical outcomes for these individuals that go through the program. It enables these individuals to better manage and cope with their chronic conditions and the challenges of living with their chronic conditions, so things like their symptoms and pain and those sorts of things. And what it's led to, at least Kate Lorig with their research, is they've noticed a decrease in healthcare utilization costs. So we thought, if we could apply a similar model here using the resources that have already been created by Stanford and their team, it'd be interesting to see how this plays out in our geography. And I'll share with you a little bit later some of our evaluation that we've seen so far. The program consists of a series of 6 workshops. The workshops are about 2 hours in length, and they focus on supporting to the individual in learning coping techniques, the appropriate use of medication, facilitating patient-provider communication. So really how to have the conversation with your doctor, your nurse practitioner, about how to manage your chronic condition. In your handout, I believe it's the 2nd page of your handout, there's actually a worksheet list that we've included. And it details on the workshop overview the various different topics that are covered in the 6 weeks. It's something that I thought I'd provide to everyone as a reference, because the level of detail that they cover is actually quite remarkable. So how to manage symptoms, how to engage in physical activity safely, how to manage the use of medication, so forth and so on. That's the typical curriculum for the 6-week workshop series. So if we think about how this ties in then with the work that we want to support in terms of healthcare across our region, I'm going to take us back to Ontario's chronic disease prevention and framework. So it ties in directly with the personal skills and self-management support. So we think that we're offering, amongst our various healthcare providers, not only self-management skills support, but also the other elements delivery system design, so seamlessly moving people through the system, provider decision support, which is the use of best practices, and leveraging information systems, you can get to a point where you're actually supporting chronic disease management, and that's sort of the rationale for it. So in terms of the population that we're focusing on, it's those seniors that are living with complex needs, those individuals that are either at risk for chronic conditions or those that are living with chronic conditions, and extending that to caregivers of those with chronic conditions as well. I also have to touch on the fact, though, this programming speaks to those with mental health issues as well. So while it isn't an intervention specific for mental health issues, a number of mental health concerns are considered to be their own chronic condition, and certainly go part and parcel with many of the other chronic conditions that exist out there. So depression and diabetes are quite tied. Certainly bipolar and a number of the other chronic conditions are tied. And so when you're thinking about the individuals living in our community, typically you're not seeing people going around with, say, one chronic condition. It's usually a host of conditions that they're managing all at once. And I'll speak to that in a moment when we actually go through the evaluation piece as well. The focus of this intervention as well is to try and provide this sort of resource, services, available in the local community. So we envision, at least when we started this last year, that we would have these workshops running about across both Grey and Bruce counties in multiple locations throughout the year, so individuals wouldn't have to travel to access this as a resource. What I'm going to do is jump into the evaluation piece in terms of being wary of the time that we have. The evaluation strategy itself, Stanford University provides a standard evaluation package. We customized it for our use in Grey and Bruce, knowing our healthcare system. But a lot of it focuses on, as listed here, program utilization and referral statistics, outcome measures relating to healthy behaviors, outcome measures focusing on health status, outcome measures that focus on healthcare utilization. So use of primary care providers as well as use of our hospitals and the emergency department as well. And when it comes to evaluation, when individuals sign up for these workshops, and we've made them free of charge because of the support that we've had through the coalition, individuals come in and on their very first session they get a pre-workshop questionnaire, and it's about 2 or 3 pages long, asking a series of questions about their perception of how confident they are in managing their chronic condition, asking about symptoms they may be having, asking about pain, those sorts of things. At 3 months after they complete their workshop, we send another evaluation to them to get a sense as to how they're doing 3 months after they complete the workshop. And then a year after the workshop, we send another evaluation form to find out if they're continuing to maintain the same healthy behaviors since they took the workshop originally. So these are our results, and I have to mention that when I go through the evaluative results, it's still too early to look at statistical significance. We're dealing with a small number of individuals. Since we started last year in May, we've held 2 workshops with 12 people in each, so we're dealing with a small volume. But as I get to the end of the presentation, you'll see actually what this looks like in terms of our spread and sustainability plan. So the individuals that have attended the workshop, the majority are female. The average age is about 64, 65 years of age, but what I found interesting is look at the age span. From 32 to 77, we think of chronic conditions being something that develops later on in life, and yet the individuals that have expressed interest in attending these chronic disease self-management workshops span a huge age range.